Welcome to the Get Fit Guys, quick and dirty tips to get moving and shape up. My name is Brock Armstrong, and I'm the Get Fit Guy. The Moving Together Outside campaign, created by the American Council on Exercise, or ACE, has a big goal, and that is to increase the number of shared use agreements across the United States. These agreements are created between two parties, like a city and a community, and allow for an outdoor space to be used when not otherwise occupied. I had the great opportunity to chat with the Moving Together Outside spokesperson, Dr. Amy Bantham, to learn more about this campaign and to learn how we can all get involved. Now, Dr. Amy Bantham is the CEO and founder of Move to Live More. She has 20 years of experience working in consulting, health and fitness, and healthcare. She holds a doctorate from the Harvard T.H. Chan School of Public Health with concentrations in health communication and obesity epidemiology and prevention. Her doctoral project focused on physician exercise prescriptions and referrals and patient exercise behavior change. She is also a certified group exercise instructor, personal trainer, and health and wellness coach. Dr. Bantham also holds a Master's of Science from Northeastern University, a Master in Public Policy from Harvard Kennedy School, and a Bachelor of Arts from Yale University, which is pretty darn impressive, I have to say. So here is my conversation with Dr. Amy Bantham. Okay, so, I was looking at your bio and looking at all your education. You've got you've got doctorates, you've got masters, you've got bachelors, you've got everything. And they're mostly, they make sense when I look at them, the way that it sort of funnels in. But what really drew you to doing this kind of work with health and wellness in particular, and fitness and exercise? Like, what drew you to do this type of research and advocacy?
Well, I'm lucky enough to be a lifelong learner, and that was something that was instilled in me from my parents. And I would say that I first was drawn to the health and fitness industry because I became a group exercise instructor. I was taking classes at lunch, and the instructor pulled me aside and said, "I think that you should pursue this." And so I became an ACE certified group exercise instructor, personal trainer, ultimately health and wellness coach. And then I worked for over a decade on research, advocacy, public policy work for the Health and Fitness Industry Trade Association.
Nice. So it really came out of a passion of yours, and you were almost handpicked, it sounds like.
It was a passion, a calling. It's absolutely the mission of my company, which is to help people live healthier, longer, more active lives.
Oh, right. Yeah, I'm familiar with your Move to Live More campaign that you did previously. Can you tell us just a little bit more about that and how you got involved with the Move to Live More idea?
Yeah, I actually launched Move to Live More as a research and consulting firm. I launched it as part of my doctoral fieldwork when I was looking at integrating healthcare and health and fitness in communities through physician exercise referrals. And so I recognized that integrating those three sectors was critical to addressing chronic disease and physical inactivity.
So physician referrals for exercise, is that something that's becoming more common practice these days? I'm actually not familiar with it. I'd love to see more of that, but are you seeing that happening more and more?
Absolutely. I studied it for about 10 months at a New England healthcare organization. They've been doing physician exercise referrals for about 10 years. And so healthcare providers refer patients to a hospital-affiliated health and fitness center and also to fitness professionals out in the community. And so they send their patients to work with fitness professionals and at facilities. And then what I was really interested in was what was the impact on patient exercise behavior and behavior change.
Right. Right. I'm sure you're well aware of all the issues that the general population has with exercising and just getting more movement into their lives. But what are the main issues that you've come across in your work?
Well, I think that there are tremendous barriers to accessing physical activity. And so I launched Move to Live More, really looking at ways to increase access, safe, affordable, convenient ways for broader population groups to become more physically active. We have a really significant physical inactivity crisis and obesity crisis. It's been exacerbated by COVID. We have decreased physical activity levels. We have increased attention on the extent to which physical inactivity and obesity are risk factors for severe illness from COVID. And that is one reason why I was really drawn to the Moving Together Outside campaign. When Ace Fitness approached me about being the spokesperson for it, it absolutely fit in with my mission and vision of expanding access to physical activity.
I took a look at the website or the webpage that explained the Move Together Outside campaign, and it just hit home with me, right where my heart lives, just moving more and certainly moving more outdoors. But I think you'd probably do a much better job of explaining it than I would. So can you give us sort of the elevator pitch of what Move Together Outside is?
Sure, absolutely. And I'd like to do it through an example, which really hit home for me.
Oh, yeah.
I live next door to a subway station, and I also live next door to a community park. And the park is somewhat utilized, but I would say it's underutilized. And during the pandemic, local health and fitness studios and professionals were there with their students and clients using the park to provide safe, structured physical activity programs and classes. And they were able to do that by working with our city government to reduce restrictions and expand access to the park. They were able to secure permits at affordable prices and bring their students and clients outdoors. And that's really at the heart of it, what the Moving Together Outside campaign is. It's working with city governments to reduce restrictions through permits, through shared use agreements, and expand access for people who need this type of outdoor activity the most. So it improves population health. It makes these parks and playgrounds and schoolyards more utilized when they might sit dormant.
Yeah, it's just heartbreaking to see those open spaces being completely unused during this time, especially during the pandemic. But I mean, this is something, correct me if I'm wrong, that the population could use outside of a pandemic as well, like hopefully a year from now when we're a little more safe.
Absolutely. I think that COVID has provided a window of opportunity, but I think that it's a campaign that has long-term benefits. It is bringing physical activity to where people are. It's bringing it out into the community. It's setting up a structure where credentialed, qualified fitness professionals have a way to provide safe programming and to reach more and more members of the population.
Right.
And it's a win for municipal governments who are looking for ways to improve the health of their community residents.
And looking to justify maybe some of the spending that they're doing on these parks already. If they're looking and seeing them empty all the time, it's hard to justify spending any money on upkeep and making them a little bit better. But if people are really in there enjoying them all the time, then it's really a win-win situation, isn't it?
Yeah, it sure is. And a bustling, vibrant community park is a safer place. It will draw people in, and it will keep it busy, and it will keep eyes on the park. And it's so wonderful for me to sit in my home and hear the sounds of people being physically active at the next door park.
Right. So when this podcast episode airs, it'll be late spring, early summer still. So lots of time left to enjoy some outdoor
time. So if people want to get this sort of thing happening in their community, what would be the first step? Where should they look?
Well, people can become a supporter of the campaign, and we have wonderful organizations who've already signed on. Box and American Heart Association, Medical Fitness Association, Walk with a Doc have all signed on to become supporters. Individuals can sign on to become supporters, and people can go to the acefitness.org website. There's a Moving Together Outside link that they can access and become a supporter. They can help us advocate for expanding access to physical activity shared use agreements and permitting models. And they can help raising education and awareness about success stories and case studies. I talked about one success story in my nearby park. There are more success stories across the United States, but not enough by any means. And so help us by spreading the word.
So just to wrap things up, I know anyone who's been listening to this podcast for a while knows that I'm a big fan of moving outside and getting that outdoor time, that whole Shinrin Yoku idea of forest bathing and that kind of stuff. But in your mind, from your very educated mind, what are the real benefits of working out outside in particular?
Well, I think that we know the health benefits of physical activity, and we know the health benefits of being outdoors in nature. And I think the pandemic has really shined a light on the fact that we are stressed. Our mental health has suffered. We're isolated. We're not moving. We're gaining weight. I think it's an average of 29 pounds weight gain, with I think over 2/3 of Americans reporting undesired weight gain. We've got problems and we're looking for solutions. So if the solutions that we're looking at can be innovative, like I think the Moving Together Outside campaign is, really social connectedness, being able to work with others. We've been home for a year. So being able to move outdoors, be active in a group setting, I think there are tremendous mental and physical health benefits from that.
I am sold. So one more time, where can people find out more information and be able to get these resources so they can start trying to get this kind of stuff into their own neighborhood?
They can email advocacy@acefitness.org. There's a newsletter coming for supporters. There's an advocacy toolkit coming, and there's a directory of these wonderful case studies coming. So people can email. They can also access more about the Moving Together Outside campaign at acefitness.org.
That's awesome. Now, you are also a podcaster, so I'd be remiss if I didn't ask you to throw a plug in for your podcast.
Sure. My podcast features thought leaders in healthcare, health and fitness, and communities who are addressing physical inactivity and chronic disease through innovation and cross-sector collaboration. And it airs every other week, and it's the Move to Live More podcast.
Thank you very much, Dr. Amy Bantham, for coming on the podcast today and sharing this information with us. I know it's going to make a really big difference, and we can all be advocates for our own health and well-being. And thank you for providing a way for us to do that a little bit easier and a little more meaningfully.
Thank you so much for hosting me. I appreciate your time.
All right, one more big thank you so much to Dr. Amy Bantham for coming on to the podcast today to share this information with us. And I hope you all, if you see any opportunity in your neighborhood, in your community, in your city, look up the Move Together Outside campaign and get involved so we can all start, well, moving together outside. Now, thanks for listening this week, everybody. And don't forget to tune in next week because I'm going to cover the tricky and somewhat loaded topic of motivation. I think you'll enjoy this one. And again, if you're interested, make sure you check out Dr. Amy Bantham's podcast as well. And I'll put everything that we talked about in the show notes over at getfitguy.quickanddirtytips.com. Now, my name is Brock Armstrong. I'm the Get Fit Guy, asking you, what are you waiting for? Get outside and move together more.